All right, we'll have a little clarification on iontophoresis in case you're a little confused on this yet. So iontophoresis is when we take electrical current, and we're going to use that current to drive medication across the skin barrier. Just some general information. This is the only modality in the athletic training arena or facility that we will use a low volt DC or direct current. So because of that, polarity is really of a concern. The medication that we utilize will either have a positive or negative polarity, and the electrode leads have a positive or negative polarity. So depending on the medication that we utilize, you'll need to know the polarity of it, and there's 4 general medications, and those are in your notes in your study guide from the book, and so you should be able to get those. But the medication is put on the active pad, so if we look at this when they're treating lateral epicondylitis, it looks like. So the medication is put on this pad, and let's say that it's dexamethasone, which is a negative polarity. And so with ionophoresis, we want to use a lead or a current that has the same polarity as the medication. And that's because the same polarity, this negative current driving through, will push those electrodes away from this active electrode and then towards the opposite, which is a positive electrode. So make sure that the lead and the medication are the same polarity. So here's a schematic of it. This is our active electrode with the drug injected into it, and we hook up the current with the same polarity, and it pushes the ions across the skin barrier and into the tissue. The current, of course, continues through towards the dispersive, which has the opposite polarity of the medication. So just wanted to make sure that you understood that, and when you're setting it up in lab, that you get the polarity correct. This is also exam week, so you'll be having an exam over the iontophoresis and the electrical stimulation, and ultrasound, I believe, is on this exam too. So be sure you review the contraindications for those modalities, make up your 3x5 cards, understand the physiology behind those. So thanks and do well.